Bob's always healthy, but doesn't seem like everyone at the office is sniffling or coughing, sneezing, and snorting. Kind of drives you nuts, right? Or maybe it's your kids. They're particularly good at bringing bugs home to us. So how can you survive the season of infections? We need some help. So that's where Dr. Rebecca Andrews comes in. She's a primary care physician at the UConn Health Center. Good morning to you, and thanks for coming in.
Good morning.
And you're healthy.
I am.
Good, good. But you've been hearing about the different things that have been going around. I was just sharing with Dr. Andrews that my whole family was wiped out recently by the stomach bug, and that's a biggie that we're dealing with, isn't it?
Yeah, you know, when people are indoors over the winter, they tend to spread illnesses. And right now, there's a stomach bug that everybody's getting and passing around their family.
Oh, it's nasty. I hope you don't get it. You know, another thing, obviously, this time of year, we always deal with is cold and flu. And it's the question we ask every year, how do you know which one you have? Because the flu, obviously, is a lot more serious, potentially, depending on who gets it. What's the difference?
So if you think of your common cold as something that might start with a sore throat and then you get some nasal congestion, you feel ill, probably if you're an adult you don't have a fever,
right,
and it lasts a few days, but by day 5 you're definitely feeling better. The flu can leave you down and out in bed 3 days up to a week. You have a high fever and your whole body aches. You really feel like you've been run over by a truck. You're fatigued, you're really tired.
Safe to say if you have the flu then, you probably know it's the flu?
If you have the flu, you probably know it's the flu. You feel much worse than with a common cold.
So, you know, a common complication with the flu that you have to worry about is pneumonia, right?
Yeah, there's pneumonia that can be associated with the flu, and it's one of the reasons we want people to stay home and get better as quickly as they can.
Can you prevent getting either one? We always hear that, you know, wash your hands and don't touch your face. Is there anything else we can do, or is that kind of our best defense?
Well, there's a couple of things you can do. You can protect your immune system and keep it bolstered by eating healthy, getting enough sleep at night. I know my kids hate to hear that, but that's one of the ways you can keep yourself healthy. And honestly, it's hand washing, but not just hand washing. 20 seconds of hand washing with warm water and scrubbing any germs that you might have on you off.
They always say sing the happy birthday song, right?
Yeah, you have to sing it twice.
Oh, you have to sing it twice?
You have to sing it twice.
Oh man, I've been getting that wrong for years then. And warm water, or warm to hot even. Cold
yeah,
is
warm water, but it's really the scrubbing action that gets the germs off.
Okay. So, you know, I think a lot of people too think, okay, once I feel better, I'm good to go back to work, everything's fine, I'm not contagious anymore, but that's not the case, is it?
No, you're actually contagious usually before you start to have symptoms, but then you're contagious for about 72 hours, sometimes as long as 4 days after you became ill. And so during that time, stay home. Don't bring the flu to work. A common cold, even that we don't like to spread, but definitely the flu. Don't take it to work.
You're going to be very unpopular if you do, especially if you give your coworkers that stomach bug. It's a nasty one. Dr. Andrews, thanks so much. Really appreciate you coming in. Hopefully we kept people healthier.
Thank you.
Thanks.